Welcome back to our Riverside Chats. Continuing with Mental Health Awareness Month, we'll be digging into a bit of history today. The history of mental health care. It's long and complex. Changing with the times and understanding of the human body, treatment, and stigma, mental health care is always evolving. Over the centuries, mental health care has evolved from harsh and often inhumane treatments to more compassionate and evidence-based approaches. Here's a look at the major milestones in the history of mental health care. Now, we've actually seen evidence of mental health treatments in some ancient civilizations like Egypt and Mesopotamia. Mental illness in ancient times was often attributed to spiritual or supernatural causes. However, in ancient Greece, the physician and philosopher Hippocrates proposed more natural explanations for mental illness, such as an imbalance of the four humors: blood, phlegm, black bile, and yellow bile. Greeks also recognized mental illness as a medical condition, though treatments remained limited to herbal remedies and basic therapies. Taking it one step further, the Roman physician Galen also believed mental illness had a physical cause, which resulted in some early forms of institutional care. Moving forward in time to the medieval period, science took a backseat as mass religion grew. Mental illness was once again believed to have spiritual explanations. People exhibiting symptoms of mental illness were sometimes accused of witchcraft or possession. Many were subjected to torture, exorcism, or execution. During the Renaissance period, mental health care shifted to something known as humanism. This Swiss physician, whose name I can't pronounce, started to advocate for more human treatment of people with mental illness, viewing it as a disease that needed to be treated with care rather than the result of a demonic possession or sin. In the 18th century, advocates for mental health reform began to argue for more humane treatment of those with mental illness. A French physician by the name of Philippe Pinel is often credited with pioneering more humane treatment for the mentally ill. He removed chains from patients in Paris and encouraged the use of moral therapy, treating patients with kindness, respect, and individualized care. Pinel's work laid the foundation for more ethical treatments. While in the United States, Dorothea Dix became the leading advocate for the mentally ill in the 19th century, where the understanding of mental illness continued to evolve and psychiatry began to emerge as a medical field. Psychiatrists like this guy from Germany, whose name I'm not going to butcher, began to classify mental illness into categories such as schizophrenia and manic depressive illness. Many countries began to create large mental institutions to house those with mental disorders, especially in the wake of the moral therapy movement. However, these institutions often became overcrowded, leading to substandard care, neglect, and even abuse. The 20th century marked significant advancements in the treatment of mental illness with the advent of psychiatric medications, new therapies, and social reforms. Freud's psychoanalytic theory dominated early 20th century psychiatry. In the 1930s and 40s, behavior therapy, which focused on changing patterns of behavior through conditioning techniques, was also gaining prominence. The 1950s marked the beginning of the modern era of psychiatric treatment with the development of antipsychotic medications and antidepressants. These medications revolutionized the treatment of mental illness, allowing many patients to manage their symptoms outside of institutional settings. As the 20th century transitioned into the 21st, the focus shifted toward more holistic approaches to mental health care. Mental health care became more integrated, using a model that recognized mental illness is influenced by a combination of biological, psychological, and social factors. Mental health care in the 21st century has become increasingly integrated into public health, with an emphasis on early intervention, preventative care, and reducing the stigma around mental health illness. And now the use of technology in mental health care is a growing field with online therapy services, mental health apps, and virtual counseling. The history of mental health care reflects significant changes in our understanding of mental illness, from spiritual or supernatural explanations to more medical and scientific approaches. Over time, there has been a shift from inhumane treatment in asylums to a focus on therapy, medication, and community-based care. There's still a long way to go in improving access to services, reducing stigma, and ensuring equitable treatment for all. But unfortunately, that's all the time we have for today. As always, stay happy and healthy. Until next time.